Welcome, everyone. My name is James Wood. I'm with Alberta Health Services Communications. We're here today with Dr. Franco Rizzuti, who is one of the Calgary Zone Medical Officers of Health with Alberta Health Services. So he is here to discuss the public health aspects of this E. coli outbreak situation, which you are all aware of at this point. So, how we're going to do this is Dr. Rizzuti is going to lead off with some opening remarks, and then we will go to questions. So, there are a lot of people on this call. And so, what I will ask everyone to do is if you can indicate to me if you have a question, you can do that either by raising your hand or by putting information within the chat box that you have a question. And I will call on you. You will get one question and a follow up. We will try and get to as many people as possible today, but given the number of people on the call, that may not be possible. I just want to add, we will. I'm not sure, in the chat. Are also going to be adding in a URL to a AHS website that has a lot of pertinent information in relation to this situation. So with that, I am going to turn it over to Dr. Rizzuti. Thanks very much.
Thank you, James. Good afternoon, and thank you everyone for joining us here today. I want to start by saying that AHS and myself personally understand the stress, the concern that this is causing families with these sick children. I know it's a very difficult thing to deal with children and with this outbreak, and my thoughts, AHS's thoughts, do go out to those kids and their parents. As of today, AHS is reporting a total of 96 laboratory confirmed cases linked to this E. coli outbreak, with 22 hospitalizations, 16 of which are at Alberta Children's Hospital and 6 at the Peter Lougheed Centre. The majority of individuals who get sick from E. coli generally improve on their own and without specific treatment, typically within 10 days. However, a small portion may develop more severe complications. Currently, we have a handful of children who are hospitalized with these more serious illnesses related to this outbreak. Alberta Health Services public health team is currently investigating the source of this outbreak, and at this time, we have not identified a source. Our staff are working very closely with the operators who have been terrific partners in managing this outbreak and communicating with the parents. So we are working with the operators of 11 facilities, which we've issued closure orders for. These sites will remain closed until the issue is resolved. We will continue to keep affected families informed and equipped of guidance for what symptoms to monitor for, testing information, and next steps. So AHS will continue to keep the affected families informed and equipped with guidance on what symptoms to monitor, as well as information on testing and isolation. Earlier today, we have launched a public-facing webpage, which the comms team will provide in the chat. This is going to be our single source of information for parents. It will provide information about this outbreak, about symptoms to monitor for, as well as information on testing and exclusion or isolation needs. I really do encourage all parents to use this document and to read this website. If your children are concerned about symptoms, if you're seeing that yourself or children have symptoms, we are encouraging you to please have your child assessed. If it's more minor symptoms or not related, not a gastrointestinal symptom, we are asking that you call 811. As you can appreciate, our children's emergency department is quite busy, and we don't want other folks getting sick. And so if this is a symptom not related to a gastrointestinal infection and more minor, please do call HealthLink 811. For any symptoms, gastrointestinal or severe symptoms, please do bring your child to an emergency room to be assessed. If your child is not symptomatic, so no symptoms, please do not take them to the hospital. If you have concerns, your best point of contact is going to be HealthLink. As well, we have provided stool kits, so stool specimen collection kits to each of the operators for children. And parents of these daycares are going to be best served by connecting to their daycare operator for stool kits. We have provided enough stool kits to each site for all enrolled students or daycare attendees. I also want to stress that the Alberta Children's Hospital is well equipped to handle the situation. We have dedicated teams of specialists focused on diagnosing and supporting any children who present to the emergency room or who may need to be admitted. We have also opened up additional beds at the Peter Lougheed Center, and we will have a follow-up clinic running to continue to follow children after they may be discharged from either hospital or the emergency department. I'm happy to answer questions.
Okay, so I've been trying to take write this down in order of what I've noticed the question. So we will start with whoever is under CTV yellow 23. So one question and a follow-up, I'll just remind you.
Perfect, thank you. Yes, this is Nicole with CTV Calgary. So my first question, we did see that there was a document with some previous violations linked to this central kitchen fueling mines. Just wondering if AHS is able to comment on that at all, and whether there's any concern with those previous kind of violations and what we're seeing now with this outbreak.
Thank you. So as folks may know, Alberta Health Services, our public health team, inspects all restaurant facilities, both as part of routine monitoring as well as any complaints that we may receive through the public. At the time leading up, immediately up before this outbreak, this kitchen was in compliance with health regulations. And so as you know, these reports are publicly posted. So all violations and then remediations are publicly posted. So at the time leading up to this outbreak being declared, our understanding was that the kitchen was in compliance. I was the medical officer of health on over this weekend, and I can say that with the number of children we were having and that there was a central kitchen involved, that led to my decision to, out of an abundance of caution, to close these 11 sites who all receive food from the central kitchen. So at the time, the previous violations was not part of my decision making.
Thank you. And my other question is, I know you mentioned that the source is still under investigation. Some parents, of course, are just speculating at this point that it was a meatloaf that kids got on Tuesday. Again, I know you guys can't say for sure, but is there any thoughts on, was this maybe related to meat? Was it, lettuce? Like, is there any maybe just within the food categories? Are you guys leaning one way or another?
We had our public health inspectors out on the site first thing yesterday morning, and they collected a number of food samples, both leftover foods as well as frozen foods from the site, and these are being tested in our laboratory. So these do take some time. Typically, in situations like this, outbreaks like this, we may not find a food source. Our main focus thus far has been to prevent any additional transmission or spread of this and to ensure that children are safe and have access to any care that they may need.
Thanks.
Okay, next person I had was Jennifer Lee from CBC.
Hey, thanks for taking my question. Dr. Rizzuti, you mentioned a handful of kids with more severe illness. Can you give us a sense of how many are, I guess, on dialysis? How many are or have come down with hemolytic uremic syndrome? And I guess what's your level of concern about, I guess, the severity of these cases?
E. coli can cause a variety of symptoms, as I said. The vast majority will improve on their own. However, we do know a small proportion may develop these more severe illnesses. So such as you said, hemolytic uremic syndrome can be a severe consequence. The Children's Hospital has been prepared should we have children who develop any severe illness, including hemolytic uremic syndrome or HUS. At this time, because we do have small numbers and I want to respect the privacy of these parents, I'm unable to speak to the exact numbers. But as I said, it is a small proportion of our laboratory confirmed cases who do have severe illness in hospital at the moment.
Okay. Um, and I guess in terms of the wider scope of this investigation, who all is going through the testing? Is it everyone connected with those daycares, like all the children presumably, but then the family members? And can you speak to any onward transmission that may have happened?
As part of our investigation, what we're doing, so as I said, we have collected food samples. Our public health investigators are having phone calls with every child and their parents who has tested positive. As well, we are conducting stool testing of all attendees, all contractors, and all staff who attended the daycare, the daycares which we have declared on outbreak. That's not all 11. Many of these were out of an abundance of caution. So those daycares who have been declared on outbreak have received messaging from public health with a requirement and an ask to have stool kits collected, and they've been provided stool kits at their daycare operator that they can pick up. In addition to this, we're continuing to do active surveillance throughout the community. So I'm in regular contact with physicians at our acute care sites as well as in the community, and we're working with a lab to monitor for any positive E. coli stool culture infections. And we're cross-referencing that with the lists that we have to ensure that anyone who may be linked to this, we're able to connect with and better understand the scope of this. It is still early days in terms of that forward or secondary transmission. We do know that E. coli infections can spread person to person through fecal oral. So I think it's really important to stress proper hand hygiene, wash your hands regularly, vigorously, 20 seconds with warm water and soap, as well as proper cooking of foods at home. That's going to be the most important piece. And HS will continue to monitor if we're seeing any linkage or secondary spread.
Great, thanks. Next person, Adam Toy from Global, please.
Quick question with regards to the hospitalizations. You've got 16 at the Children's Hospital, 6 at the Peter Lougheed. Wondering if you can explain why the separation between the two acute care centers. Is hospital capacity an issue? Wondering if you can provide some clarity on that.
Within Calgary Zone, Alberta Children's Hospital is our primary pediatric site. However, we do have a pediatric ward at the Peter Lougheed Center. And so the clinicians at the Children's, based off of eligibility, made the determination of a child at Children's versus the Peter Lougheed. So this is routine in terms of sharing the capacity and the load between the sites. And this was also being thoughtful of overall Alberta Children's Hospital capacity and just, again, being prepared should we see any additional need for hospitalizations or support.
And I know when you were answering Chen's question there, you said that, or you recognize that HUS is a possible outcome of this sort of E. coli bacteria. I'm wondering if you have seen any indication of children who are showing these symptoms that indicate HUS.
From my role as medical officer of health, my predominant focus thus far has been in the community with the operators of these 11 daycare facilities, understanding potential source and limiting spread. So I have not been directly clinically involved in the care of any of these patients, so I'd be unable to speak to their clinical status and that element.
Thanks. Next hand up I had seen was Alana Smith from the Globe and Mail.
Thanks for taking my question. My first one's also a follow-up on Jennifer's question. When you said serious illness, I'm just wondering if you mean life-threatening. And then I'm not still clear following Adam's question. When you say severe complications, can you offer any details on what exactly those complications are?
With E. coli, gastrointestinal infection. So these sorts of infections. I want to stress that the vast majority of children, of adults who do develop E. coli do get better on their own without the need for emergency room visits or hospitalization or any additional supports. That said, there are a small portion who may develop these severe illnesses or symptoms. What this ranges from is it may require a short hospitalization for rehydration, but this can also range to that hemolytic uremia syndrome, where we are closely then monitoring kidney function in these children or adults. They can develop in both. And so it's a small portion. That's, the band. As well as any time there's an infection, we always want to make sure that folks are otherwise doing well. Blood pressure is okay, heart rate is okay. There's no signs of severe infection, sepsis, things like that. So that's why sometimes these folks may be hospitalized for monitoring, and the clinical teams, the specialists we have, are very comfortable with this. But I do think it's important to stress that for many of these, the vast majority, they will improve on their own at home.
So I don't think that answered my first question. I'm wondering if any of the kids who are facing more serious complications are in life-threatening condition. And then for my second question, hoping you can explain whether or not all of the daycares that have been closed have cases linked to them, or if there are some that have no cases at all.
With regards to your first question, as I said, I don't have the clinical specifics on hand, so I would defer to the communications team for that. As to the second question about these 11 daycares, we're continuing to investigate. At this time, there are a few daycares who do not have cases linked to them. However, this is still early days. We're still conducting our public health investigation, and so we may find cases. It was out of an abundance of caution because of a shared kitchen, shared food, that it was decided to close these 11 daycares, and we're continuing to operate under the function or the thinking that there is a central food source in this outbreak, and we want to make sure that we're not reopening without being confident of source and controls in place so that no other children get sick.
Yeah, Alana, if you want to send along any follow-up questions that you had, if you want to send them to Carrie and myself, we can take a look at them and try and get them to the appropriate person.
Thanks, Will.
I think we have 2 questions left, and we're gonna wrap. So there's 2 left. We'll wrap it up after those 2. Tate, we will. In regards to your request, we will send you the video of it when we have it, rather than getting Dr. Rizzuti to recap everything, because he's a very busy fellow, as you can guess. So we will go to Sarah with Global, and then Catherine after that.
Hi there. Sorry, I'm just wondering specifically if we can say whether the cases that of people that are hospitalized are children or if they're adults.
At this time, I don't have the specifics on that breakdown. Again, I defer to the comms team to be able to speak to that. All that I have from my end and we're tracking is number of hospitalized cases.
Just as a follow-up, still just really trying to get a sense of how severe these cases are. And I'm wondering even if we're able to say when these cases came into hospital, if they came in through the emergency rooms or if they were regularly admitted or directed by doctors, if you can speak to that at all.
Over the weekend, I was on call, and I can say I began receiving phone calls from the emergency department on Saturday with concerns of seeing children with bloody diarrhea. And we very quickly mobilized our public health team. Letters were sent out to the daycares, 3 of the sites on Sunday, Early Monday morning, I made the decision to close these 11 sites and communicate that out to the parents. And I know that the hospitals continue to see children present. My understanding is children have presented through the emergency room, assessed by emergency room physicians, and clinical decisions made by the specialists and experts at the various sites across the city as to if a child needed more further assessment or support, if they required admission, or if they could be discharged home. Children and adults who presented to emergency room, we have had stool kits collected, and we're continuing to follow up on these results. If there is a need for ongoing care, as I said, the Children's Hospital has a follow-up clinic that they are continuing to monitor these children if children required admissions. We have a dedicated expert specialist team at Children's who's very comfortable and has a lot of experience managing these sorts of infections.
Okay, Catherine, I think you are it for the final question.
Okay, so you mentioned some of the steps you're taking in this investigation, going through the stool samples and the leftovers and frozen food. I'm wondering, can you walk me through what are the next steps and perhaps a timeline if there is one?
So in terms of our investigation, as I said, we worked very quickly to close the daycares over the weekend. This was our priority, to limit any potential further exposures, risk of spread. So that was done over the weekend. Our public health team was working very much over the weekend. And then first thing Tuesday morning, we had our inspectors out to the kitchen site to inspect the kitchen, to collect food samples. Over this week, we have been continuing to collect stool samples. We have sent out over 2,000 stool kits to the daycare operators to make available. We are monitoring all of these results. We are conducting investigations, so phone calls to each of the confirmed positive households. We will continue to post information on our website, and we have a team of expert scientists who are linking our data, looking at how cases connect together, which daycares they're at. So we're still in the process of identifying, all of these connections. We anticipate that will take time this week. We're also reviewing all of the lab results. Lab results do take some time, usually a few days, to come into us. And so as we have all of these pieces in place, we'll then make decisions of, is there ongoing risk to children, to attendees of the daycare, and that will inform opening of these daycares. So as we've made these decisions, that will be both, again, posted onto the website, as well as communicated out to the daycare operators and to families on when daycares are opening. So that our investigation is going to inform that. Again, our focus has been to ensure that no other children get sick, and that any children who are sick or who need access to services have access to acute care. And then we anticipate our investigation as to the exact source, as to the linkage, may continue to take time into the weeks and months ahead.
And for those who are in serious condition, is it fair to say that those would be ICU stays, or is there a distinction between those acute care versus the ICU beds?
I would defer to our comms team and the clinical staff as to where these patients are and how serious illness is supported within the hospital. So I would defer to HS to be able to provide some of these details.
All right. Well, I want to thank everyone for coming out today. And of course, I want to thank Dr. Rizzuti for taking the time today. So yes, if any follow-up questions that you have, please get in touch with myself and Carrie, and we will see if we are able to provide. So anyway, thanks very much, everyone.